Good Day Kansas continues with another Fit and Well segment. Today we are tapping into the incredible resource we are lucky enough to have known as the Riordan Clinic. And today we are spending time with a doctor at their Hayes location. So I introduce to you Dr. Dustin Moffitt, a naturopathic doctor. Thank you so much for your time today.
All right. Thank you for having me.
Of course, there's so many different treatments and therapies and just such a solid resource that Riordan Clinic is. But today we are tapping into one of the specialties that you're going to share with us a little bit about. It is bioidentical hormone replacement therapy. So Dr. Moffitt, just start off and explain a little bit about that, please.
All right. Well, to keep it short, bioidentical hormone replacement therapy is just also known as BHRT. So what the bioidentical portion means is the chemical structure is very similar to what your body makes naturally. So we're using the most natural form of hormones available that tend to have the least amount of side effects and are known to be the safest out there. And so what we use the BHRT for is treating your typical menopause-based symptoms or andropause-based symptoms.
So would this be a very specific patient then who is seeking out this therapy?
Sometimes, yes, they are pretty straightforward, like women that are just dealing with extreme hot flashes or night sweats. That's a big one. Or men with low libido or lack of muscle or depression. Those are big key indicators.
Okay. And then what are some of the goals or expected outcomes of this treatment?
So some of our best goals to look for is better cognition, so less mental fog, better sleep quality, better energy throughout the day, a better sense of well-being.
Just walk us through a little bit about the therapy. What does it look like, and how does Riordan Clinic approach this?
Okay. So bioidentical hormone therapy can be done in many different ways. You will see a lot of them that we do here are called a buccal membrane absorption, or a troche lozenge is what people will call them around here. We can do drops, we can do creams, and then there are some places that will do injections or even pellet-based therapy as well.
Oh, wow. And is it a one session, or is this a longer treatment?
So for safety and observation, we always make sure to follow up no more than 6 months, because we want to make sure that we're dialing in those hormone levels specific to your levels. And the way we know that we're doing that is through lab analyses. So we'll actually run assessment of your hormones. And here at the Riordan Clinic, we actually run hormones and thyroid at the same time, because they do go hand in hand on controlling a lot of underlying symptoms.
Dr. Moffitt, if we want more information on this therapy, where can we get it?
The best place would be to go to our website. So it's riordanclinic.org.
Excellent. Thank you so much for your time today, Dr. Moffitt.
Thank you.
We do have more Good Day Kansas coming up after the break.